October is National Substance Abuse Prevention Month. So, here on the UMB Pulse, we'd like to take this opportunity to speak with a recent graduate of the University of Maryland School of Social Work, Melanie Yates. Melanie graduated this past spring and she received her Master of Social Work in May. And she's already been making a tremendous impact here in Maryland. And actually, she started before she even graduated. She submitted a bill that's now known as the Josh Siems Act, which was named for her late boyfriend, who passed away from a fentanyl overdose. The act requires Maryland hospitals to test for fentanyl now, which is something that normally has not been done in the past. And it was signed into law by Governor Wes Moore in the spring. The law became effective on October 1st. For her extraordinary work, Melanie was awarded the Clinical Field Work Award from the School of Social Work Office of Field Education and Exemplary Clinical Award, which is chosen by her peers. So, a word of caution to our listeners: this episode tackles conversations about addiction, about overdose, and about family loss. It hits close to home for me, as 2 years ago I lost my youngest brother due to a fentanyl overdose. And this legislation was not in place then. So I think it's an encouraging conversation. I hope that you can listen through its entirety to hear not only the great work that Melanie has done, but how laws are changing to help our own family members who might have addictions and who might go through something like this in their lives.
You're listening to the heartbeat of the University of Maryland, Baltimore, the UMB Pulse.
Melanie, thank you for joining us and being here on the UMB Pulse to share your journey and your story. We hope this can help not only inspire others, but ultimately save lives through the work that you're doing.
Thank you so much for having me.
In our opening, we referenced your work and how you've helped make some significant changes in the area of drug use in Maryland and drug testing in Maryland. And here on the UMB Pulse, we like to talk about our change makers, people who are from the university, who are making a difference in the real world. And as a recent graduate of the university, you have a great story to tell. So before we get into discussing your meaningful work, let's start with who you are. You were a student at American University. You received a bachelor's degree in environmental science. So what were your original aspirations and how were you led to wanting to even work in behavioral health?
So, when I originally was in school, I really wanted to be a marine biologist, and I really wanted to study sharks. And that's why I pursued an undergrad in environmental science. Did a bunch of internships, didn't find anything I really loved. So, for the remainder of my 20s, really, I tried every job known to man. My brother said I should be a career coach because I tried everything. um, I moved to Nashville. I moved abroad for 4 years. I worked everywhere. I worked in bars. I worked as a barista. I worked in merchandising for a while. I tried everything. And then when the pandemic hit, I think I, just like everybody else, was trying to reassess your life. And I was trying to figure out what brought me meaning because I just wasn't loving what I was doing. I was living in Ireland. I was pretty isolated. They had pretty strict lockdown rules. And I just wasn't feeling fulfilled in my life. And social issues has always been something I really cared about. I'd been kind of contemplating moving back to the US. And I decided to apply to social work school because I had one of my friends who had just started, and I thought what she was doing sounded really interesting. I'd always been really addiction and interested in addictions work. For some reason, the opioid epidemic, when it first began, really 15 years ago, was something that just really interested me. And that was something that I was interested in pursuing along with prison social work. So I was really interested in forensic social work as well. So I came into UMB interested in both addictions and forensic, and was lucky enough to actually work at UMB's law school for my first internship doing forensic social work and getting to work in the prisons and starting to work with people with addiction issues. And that is where it led me to my second year internship at Johns Hopkins Broadway Center for Addiction. And I just fell in love. I love working with this population. I think it's a forgotten population, especially in social work. A lot of folks think that we just work with kids, but almost all my clients are, 50 plus and have had chronic homelessness issues, chronic addiction issues. And I think just lending a helping hand is something that I find really meaningful.
Wow. Yeah, that really, really is impactful. And so, fast forward, when you were enrolled at the University of Maryland School of Social Work, you worked on something that resulted in the passage of the Josh Siems Act in the General Assembly, and that requires fentanyl testing in Maryland hospitals. So, if you don't mind, before we talk about the law, what would you like people to know about Josh?
I think the thing to know about Josh is and I think you hear this a lot with people who have passed from addiction and overdose is that they were the light, but like I've never met anybody that like Josh that can make you feel so seen and known and heard. There were 1,000 people at his funeral. Like we were literally overflowing into the parking lot because people couldn't get a seat. That's how many lives he touched. And he was 31 when he passed. But I think, made probably one of the biggest impacts. It was truly astonishing. You walk down the street, and when we were dating, it got a little annoying. Cause I'm like, babe, we got a restaurant, we got to wait things to do. And he's like, but I know that person. Let me just say hi. And like, oh, that's somebody's mom. Like, let me just run over the street and say hi to her. And he just loved loving people. And I think that's something that a lot of people, um, tend to forget about people with addiction issues is that they're human. They're not just their addiction. There's so much more to them. And he was funny and kind and was a rabid Ravens fan and a rabid Orioles fan and just really loved living.
Well, thank you for sharing that. You got me teared up.
Yeah, this will be a tough episode for some folks listening, and then for you sharing. So we appreciate everything that you're sharing. Ultimately, for the benefit of others, revisiting this crucial moment. Unfortunately, when he passed, take us through what happened at the hospital. 'Cause this is the where things really kind of change when we learn about test results. And did this take place in Maryland near DC? Is that right?
Yep, so right on the border. So he was living in DC at the time and I was living in Baltimore. So we did a medium distance relationship. So we kept swapping weekends. So we got to the hospital and he was there on a ventilator. And at the time, his family and I had just assumed that it was a fentanyl overdose. He became addicted to Oxycontin in college. His friend had an injury and had some extras, and it was 2009. So nobody really thought anything of something you get from the doctor. And for whatever reason, he fell in love with it. And so Oxycontin was easy to get back then. And obviously, as regulations changed and laws changed, it became harder and harder. And eventually, he was buying from a dealer, and they were saying, hey, heroin's a lot cheaper. And when you're already physically addicted, it's basically like you have a glass of water across the way and you're so thirsty you're going to die, but you can't drink it. That's how I would think you would equate the feeling. And he then eventually, ended up with fentanyl because fentanyl has basically overrun the drug market in the US. I think it was something like 90% now of all opioids in Maryland are fentanyl, not heroin, even though everybody will swear it's something else. Um, so when we saw him in the hospital, we just assumed it was a fentanyl overdose. His parents had seen him the day before, and we had essentially been planning an intervention to send him back to rehab for significantly longer than he had been before. And when we got there, it took probably 3 days to get our test results, give or take. We knew that he wasn't going to live. His heart wasn't able to keep pumping on its own. He wasn't able to keep breathing on his own. So we were waiting for the transplant team to essentially get together and find all the recipients so that we could try to donate as many organs as possible. And a nurse came in, and he had just happened to pull up the drug screen. And we were like, oh, well, what happened to come up? Because like we were just curious what came up. And there was like, oh, only cocaine. And we were like, cocaine? And we're like, okay. And it's very common, for people who use opioids to speedball, use cocaine and fentanyl, heroin, whatever at the same time to kind of regulate yourself. But then we were thinking, did you did you die of a heart attack? And then I'm thinking, I would rather have you die from an opioid overdose where you just slowly go to sleep. I don't want you to have a heart attack and have passed. And so for a couple days after, we were just very confused as to why. Also, when we went to his apartment, within that time, we found the fentanyl. They call it blues. They're like little blue caps with blue powder right on his thing, um, right on his side table. And I was like, okay, so I see the fentanyl here. I see the straw that you were using. I'm confused how only cocaine has showed up. And about a month later, so we had, after that time, we had just assumed, okay, maybe it was just cocaine. Maybe it had gone out of his system too quickly. 'Cause fentanyl processes like 24 to 72 hours. We were just basically explaining it all away. And the Symeses are close with a doctor that works at Johns Hopkins. And he said, oh, it's probably because they didn't test for it. A lot of times they don't come up and test for fentanyl. They knew he was already dead, if to put it quite frankly, and they don't need to run the extra test. Um, and that's how I found out that fentanyl is not included in the standard drug screen. So, of course, heroin's not going to come up. Opiates are not going to appear on the drug screen because he didn't have any in his system. He had synthetic opioids, which is the very minute difference that I think even I've heard some doctors and nurses missing, and I think especially the general population, is the assumption that, well, we know fentanyl has taken over Maryland and the US. Wouldn't it just be logical that it's already included in the drug screen? And that is how I found out that it wasn't. And I kind of had the crazy idea like a month to the day, actually. And I texted my best friend saying, is it crazy that I think I might try to pass a law in Maryland? And she was like, well, what do you mean? And I was like, I'm going to see if I can try to get fentanyl testing onto the standard drug screen. They did it in California last year. So, like, is it crazy to think I could do this? And she was like, it's not crazy.
That's incredible. Like the detail and just how everything unfolded, where it's you go down a rabbit hole essentially with regulations and finding out things, and as you said, you're trying to explain stuff away, but then it comes up, you're like, wait, there's something here. And so what did you learn further about hospital testing and I guess what's known as the federal five, right? And how much you had to like dig through and to, I guess, be prepared before you started, wanting to present a law.
So I think a rabbit hole is the perfect description. That is also how I described it, or I was like, I just went through basically a research rabbit hole. And the research that really caught my eye that I thought was, to me, the critical piece for getting this law passed was a University of Maryland Medical Systems study that had come out, I believe, 2019 or initially, that found that only 5% of overdose patients are being tested for fentanyl in the Maryland health systems. I ended up reaching out to those researchers. They then were saying, oh, we're already actually doing more research on, it was a few hospitals along the Chesapeake between Baltimore and DC. And they actually came out with their findings in February of this year. And that actually ended up citing our law in it that reinforced, hey, it's still not being done, even though this is now 4 years ago that we published these studies and we encouraged hospitals to change these policies. So I think I did probably about a month of reading every single article on the California bill, talking to the researchers. And then I reached out to my first supervisor at UMB at the law school. And because I said, hey, lawyers might know something about passing a law. This might be crazy. And she connected me to one of the professors at the law school who was like, hey, I think my clinic would want to take this on. And I think we can assign one of our student attorneys. I think this is a really great piece of legislation. And I really honestly couldn't have done it without her, and without the help of Will O'Malley, who ended up being my like a student attorney, student intern. And he and I started creating this law based around the California law and we picked apart, pieces that we wanted to take out. So they've got a sunset clause on theirs wherein a few years the law will no longer apply. We're like, we're going to see if we can get away with that not being in there and just reworking a little bit and trying to better it as we went. And so it was probably a good month before we even started to talk to legislators. And I thought we were going to do this in 2024. And Will was like, I think we can get it done this session. And I said, okay, let's go. It's my last semester. I'm about to take my licensing exam. Like, let's just hit it. So we did.
That's incredible. Melanie, one of the things that we talked about when we did an interview when you were graduating, and we talked about how May 9th, which had just been around that time, was Fentanyl Awareness Day. And back then you tweeted something to the effect of hospitals seeing an uptick in fentanyl cases. Explain what that means to me. Are there actually more fentanyl cases, or is it just because it's being mixed with drugs we're seeing an uptick in those numbers? Like, can you differentiate between the two?
So what we're finding is that overdose deaths that have been um, labeled as cocaine deaths because they were just tested with the standard five are actually seeing a more of an uptick of this might have actually been a fentanyl related death that we just didn't even recognize. Fentanyl use itself, intentional fentanyl use, isn't on the rise. It's just permeated into literally everything now. And so now that we're testing for it, we're just seeing bigger numbers. And a lot of people will be like, well, we already know fentanyl is a problem. So why do we need the bigger numbers? I'm like, well, we need to know what exactly it's in. We need to alert drug users, especially kids who are just first starting to experiment. A lot of times they won't even think twice about fentanyl. And it's a lot of like, I've talked to some of the kids, like they'll just be like, oh, it's not a problem. It's like, we're not using that, blah, blah, blah. And I was like, but you're getting a Xanax pill off of Joe Schmo down the corner. You don't know what's in that. And you need to be able to protect yourself.
Right. So it's actually the testing is giving us better data, really.
Yeah. And so that was a big, kind of like one of our big sticking points with the law. It's not just, we wanted to know. And frankly, we did want to know what Josh died from. But it's also that how are we going to create programs off of data that's inaccurate? What if we're really underestimating the amount of deaths by fentanyl and we're just kind of being like, we know it's bad. It's okay.
You were mentioning studies earlier. There's that University of Maryland School of Medicine study that said out of the 83% who were positive for the drug, only 5% knew that they had taken it. So that goes to your point about how that awareness isn't there for people who think that they're getting something clean, right, off the streets. Shifting back to lobbyist mode, really, as now you've done your research, right? Now you have to navigate the political system, and you had student intern, I guess you like to say student lawyer. So how did you prepare yourself to map out a game plan and go down to the General Assembly and knock on doors and even find time for somebody to listen to you?
So we didn't even have time to go knock on doors. By the time we had a general idea and we had essentially skeleton written a law based on California's law and talking to Dr. Ronit Lev, who's the doctor who wrote the California law. We were at the deadline for submitting like new legislation for the year. So we couldn't even go to Annapolis and actually knock on doors. So we were calling everybody that we knew. So I was reaching out to everybody and their parents and seeing like, does anybody know a senator or like a Maryland state representative? I need somebody. And we ended up getting in contact with Joe Vogel. So he's a new representative. He's Gen Z, he's young, he's hungry, he's really interested in the same sort of policies that we are. And because he was a freshman delegate, he was saying, hey, I actually have like room on my roster. I can put you on, and I think this is great. And to us, it's really a straightforward bill. And I mean, we had, other delegates really saying over and over again, I've heard 100 times this is a common sense bill, but this is the first time I've actually heard a common sense bill. And I felt really proud of that as well because I was like, thank you. I sing it too. Um, and so we called Joe, and Joe and I had a virtual meeting. And he's like, I think we can get this done. I'm literally going to have my chief of staff run over there right now and drop it into their basket before 6 p.m., which was the deadline. And that started the ball rolling.
That's incredible.
Hopefully that's inspiring for more people to enact laws that they want to see changed, and that, if you do a lot of hard work, sometimes if it makes sense, it will find a way to get done. So that's really amazing. And then, so you had that done of just getting it submitted, and then it actually gets passed in the General Assembly, and the governor signs it into law in the spring. It's renamed for Josh. And now, as we're recording this, we're only a couple of days away from the law taking effect on October 1st. So, knowing that this has become real here, coming October, and the change it will bring, has it helped you at all, knowing that this is becoming a law that's going to change lives, and at the same time maybe helping your healing journey in some way, along with his family's healing journey?
I definitely think so. And I think, especially initially, this really gave us some purpose to kind of put our energy into. Because I feel like the first 6 months, you kind of are in like a daze or a not even quite numbness, but it's everything's foggy and it's almost as you're not really in reality. And so for, his parents and I, it was a great way to channel our energy. And for me, this year has passed incredibly quickly. And I actually realized last week, I was like, oh my gosh, it goes into effect like next week. I was like, whoa. And so for me, that was pretty crazy. I think this has probably been the most meaningful thing I've done in my life. And granted, I'm, only 31, but I think that it was something that needed to be done as well. And you know, I think Josh would have been proud. He loved politics, so I think he actually would have been a great politician. But um, I think this is just a nice way to honor his memory and to help other people as well.
Yeah, definitely helping other people. You read the numbers and it's scary. And most families, when I was growing up, this was, if you knew of someone who overdosed, it was a big deal. It was scary. It was shocking. It was kind of had a taboo thing attached to it. But nowadays, you hear it every other day. It's so common and it's so sad, and so many losses and families affected. And I go back to, we just keep thanking you for being so open and sharing your story, because it is sad. And we started out, Melanie, by talking about you and where you were in school when this all happened. I mean, for our listeners, this happened in the last 6 months. This isn't like the last 5 years Melanie's been working on this. So tell me, in addition to getting a law passed, how did you really balance that with grad school? Because you recently graduated and started your own new career.
I was really blessed with my professors that I had. So it'll be 1 year on October 14th. So in a little over 2 weeks. I took about 3 weeks off of school. I emailed my professors and said, quite frankly, hey, I don't think I'm going to come in right now. My boyfriend died of an overdose. And honestly, being in, UMB School of Social Work was a blessing because all my professors are like, absolutely, whatever you need, we can write extensions. We will figure it out for this, second to last semester. And I took about 3 weeks off. And I just tried my best on that last semester. I did end up getting all A's, which is great. So, but I was also doing well before then, so that was helpful. I did consider dropping out, and Josh's family was like, "Don't do that. You work so hard." And I was like, "But what if I instead just buy a house and remodel it? I do something else." I was like, "I do anything." This is before I really started diving into the law and actually giving myself a task, basically. Um, and that last semester, I drank a lot of Red Bull. I was tired. So I had 3 classes, and I had chosen my classes, based on classes that I really wanted to take, and classes that I thought would be very helpful for, my career. So it wasn't fluff classes. So I was like, "Oh, crap. So now I'm here, and I've got these classes, and they're gonna be very important, so I can't slack off on those." And then I had scheduled my licensure for spring break as well, so that was a craziness. But I honestly was either working on school, the law, or studying for my licensure from like 8 to 8 almost every day. I think I gave myself like one half of an afternoon off, but I wouldn't do it again. I would not do it all of it again. I would absolutely pass the law and all of it, but I think I needed to manage something better in the spring because I was running on fumes, but once the ball got rolling, you can't stop. And we didn't want to stop. And once I kind of saw that, I was like, this might actually get somewhere and do something. I was like, well, we can't stop now. We have to keep going.
That's awesome. Well, it says a lot about you as a person to have been able to that you continued. Like you didn't start out with the idea to do it, but you pushed yourself through it. You graduated. You did made some really important changes. So it really says a lot about you. I hope you're finding a little time to breathe and relax now, and you know, peace.
Yeah, I've got evenings off now, which is amazing. No more homework.
We know the law passed in Maryland, and you mentioned the California one. What do you know? I guess what this looks like for other states, and how common this is as for testing.
So, pretty much categorically, no other states test for it. It would have to be something that's implemented by the American Medical Association, and they're not necessarily keen to have things legislated, which I absolutely understand. And at the same time, change needs to happen. I know there is a law getting at least moving through the process in Pennsylvania right now. And I had some folks in Virginia reach out to me about the law because they wanted to pass something similar. So there's definitely rumblings in the states of trying to get things done state by state. There is also still a federal push. So the mom in California who helped pass that law has been really working on trying to get it federally pushed. Unfortunately, the federal government can't mandate laws for the states based on the 10th Amendment. So we're trying to work some way around to just update the regulations. So it's a little bit more complicated to just do a sweeping oversight, but we're hoping at least that the knowledge that, hey, this isn't being done and this really should be done. And how do we, change the federal five more frequently? It's not changed since I think the 1960s. So when is it time to maybe phase out some drugs and phase in other drugs? When is it, fiscally beneficial? Are we seeing enough numbers for things like that? So that's potentially a doctoral project for myself of like, when can we update and when should we update? Because I think this really should have been done 10 years ago when we started seeing such a spike.
You're now a licensed clinical social worker in the Baltimore area. What does your work focus on now?
So I am a dual diagnosis therapist in West Baltimore. So I work at an outpatient clinic, and I deal with folks who have been diagnosed with some sort of substance use disorder and a co-occurring mental health diagnosis. So that can be anything. I have lots of bipolar, depression, anxiety, PTSD. So I work with folks who have been experiencing chronic homelessness. We give them a place to stay, and then they also enter treatment with us so we can hopefully, get them off drugs and back working and however they kind of want to live their life.
Wow, that's incredible. Um, Before we sign off, Melanie, October is National Substance Abuse Prevention Month, and a few months ago, you tweeted, "Use test strips, have Narcan, and never use alone," which seems pretty self-explanatory. Do you think people are listening? Do you think that message resonates?
I wish. I think test strips are becoming more common for people who are using cocaine, active drug users, and people who, with a diagnosable substance use disorder, don't really care. They don't really have enough time. They're for whatever reason, not really going to use it. I think test strips are great for casual drug users. People, and I would say especially folks who are using cocaine who are not intending to try to use any sort of opioid. I've definitely been seeing an increase in folks using test strips there. Narcan, I think more people are having it. I think it's still so expensive. You can get it from Baltimore City for free, but that's not true across the state from Maryland. And I think if we made it accessible and made it very cost effective, people were going to have it more often. All of my clients have been written a Narcan prescription by their doctor. However, it still is going to cost a certain amount for them to get it. And is that worth it based on, a very tight income? I think the using alone is something that I think a lot of people underestimate. I think because drug use, especially for people who suffer with, an addiction issue, they're going to use alone. It's a shame-filled activity. They're not going to be like, hey, mom, girlfriend, whoever, I'm going to go use in the bathroom, so be careful. But there are hotlines that you can call, and it'll be a person that'll sit on the phone with you while you use, and you have to respond in a certain amount of time. Otherwise, they'll call 911 and send somebody out for a suspected overdose. And so there are other avenues that you can use and reach out to try to make drug using safer, because I don't think it's realistic to say don't do drugs. It's just not going to happen. It's not going to happen in any city. It's not going to happen in any socioeconomic class. It's just not going to happen. So it's how are we going to use in a safer way, and how are we going to recognize when there is an addiction issue, and these are the treatment steps or the treatment options that you can take, and something that'll get it before you're 10, 20, 30 years deep and it's a lot harder to get rid of.
Melanie, thank you for sharing your story and being so open about not only the personal loss, but shedding light on this serious and life changing topic, and how other people can ultimately be helped in light of tragedy. So I think, truly have brought UMB's mission to life to improve the human condition and serve the public good of Maryland. So thank you for everything you do, and best of luck in your future, because undoubtedly you're going to do something terrific again.
Thank you both for having me. I appreciate it.
Thanks, Melanie.
The UMB Pulse with Charles Chalet and Dana Rampolla is a UMB Office of Communications and Public Affairs production. Edited by Charles Chalet, marketing by Dana Rampolla.